Hi, my name is Hillary Robinson. This is my validation video for an NG tube feeding. I would start by washing my hands. I don't have a sink in this room, so I will just go ahead and proceed. I would close the door to provide privacy for my patient. Hi, how are you today? My name is Hillary. I'm going to be your nurse. Can you please tell me your name and date of birth? I would just compare that to his hospital bracelet. It's a match, so that's good. Are you allergic to any food, medications, or latex? No? Okay. And are you having any nausea or vomiting today? No? All right. Well, I have an order from your doctor to administer an NG tube feeding. So I'm just going to start by doing a quick abdominal assessment. I'll have to lie you flat for that. Are you comfortable flat? You are? Okay. So if at any point you're uncomfortable or in pain, just let me know. So I'm just going to start by bringing the bed up to a comfortable working height. And then going ahead and lowering the head of the bed so my patient is supine. All right. I just have to pull up your Johnny and lower the blanket to expose your abdomen for the assessment. So I would start my abdominal assessment just by inspecting. I'm looking for any redness, lesions, bruising, or distension. None is noted. So I would then go ahead and auscultate. I would start by listening in the right lower quadrant. I would listen in each quadrant for a full minute. And I want to know between 5 and 35 clicks or gurgles in 1 minute. All right, so he had babble sounds in all 4 quadrants, 5 to 35 per minute. I would now go ahead and percuss. I'm percussing for tympany. If I percussed any dullness, that might indicate an enlarged organ or mass. Tympany was noted. And I would then palpate. I would start with light palpation. Please let me know if you have any tenderness. You okay? You are? Good. And then I would go ahead and move on to deep palpation. And here I'm just noting any rebound tenderness, masses, enlarged organs. Everything feels good. So we are all set to go ahead and proceed. So I cover him up. And now I'm just going to go ahead and raise the head of your bed between 30 and 45 degrees for the feeding. And now we are at 30, and I'm going to go ahead and put this side down. I would now apply clean gloves. And I would start just by measuring the length of his tube, being careful not to tug. And I want to measure from where it comes out of his nose to the distal clear portion. It measures 36 inches. That is the length that was noted on the chart from the last feeding, so it looks like it hasn't moved since this morning. I would then want to confirm placement with an x-ray of his chest and abdomen to make sure that the tube is indeed in the stomach. I obtain the x-ray and the location is good. So now I will start by aspirating some of his stomach contents to check the pH. So I would go ahead and pinch my tube to make sure no air gets in. And before I do this, I'd also want to just place a chuck across my patient's chest so that he doesn't get dirty or wet or anything like that. And then while this is clamped so no air gets in, I pull that out. Insert my syringe, and I would unclamp and pull back to aspirate about 5 milliliters of stomach contents. And then I'd clamp again and plug it. I would then deposit these contents in this bowl here. And taking a pH strip, I would insert it to check the pH. It is bright orange, so it indicates a pH of 3. Anything under 5 is good. I also want to just note how the contents look. His stomach contents are grassy green, clear liquid. Those are all normal findings. So his pH is good. The stomach contents look good. And now I'm going to go ahead and proceed by checking the residual volume in his stomach. So once again, just clamping this so no air gets in. I would then go ahead and aspirate the full amount of stomach contents. And it looks like I got everything, so I'd clamp again so no air gets in, plug it, and I'd deposit them in this measuring cup here. So the total amount of his stomach contents are 60 milliliters, which is great. If it was 250 milliliters or more, I would have to withhold the feeding and recheck the residual volume in about an hour. So now I have to return his stomach contents. So I'm going to go ahead and take my plunger out of my syringe here and pinch this closed so no air gets in. I would then put this in and pour his stomach contents in here. I would then release and hold it above his stomach level. If I wanted to increase the rate of how it's being returned, I would hold it higher. If I needed to slow it down, I would hold it a little bit lower. And I would then, before it gets, when it's 3/4 empty, I would go ahead and pinch the tube closed so no air gets in and fill up what I need. Now, this is empty and all of his stomach contents have been returned. So once again, pinching, removing, and now I would go ahead and flush the line to make sure that it's patent. So I would once again pull out the plunger from my syringe, and I'm gonna flush it, the tube with just normal saline. This looks like it's a brand new bottle. The label's intact. It says normal saline, and I'm also checking the expiration date. It is not expired, so it's safe to use for my patient. So I would go ahead once more, pinching the tube so no air gets in, and pulling out, this in, and I would just go ahead and pour 30 milliliters of the saline so that it flushes the NG tube and it stays patent. And that has been done, so now I'll pinch the tube and cap it. And before I go ahead and administer his feeding, I just want to change my gloves and perform hand hygiene. No sink, so I did wash my hands. I'm gonna get a fresh pair of gloves. And when I gathered all my supplies, I have already checked the order. And when I grabbed his can of Ensure, I just made sure that it was what was on the order. So we'll be all set to go. Okay, so this does match what's in the record. I'm just looking at the condition of the can. It doesn't look like it's been tampered with. It's not open, no punctures on it, and it is not expired. So I would go ahead and just take an alcohol swab and clean off the top. And then remove the plunger from my syringe. Clamp the tubing so no air gets in. Remove that. Place that in. And I would go ahead and open the can and start to pour it in. Then release and hold above stomach level. And once again, the higher the tube is, the faster the rate it goes in. And if I needed to slow it down, I would just lower my hand. And before it gets, when it gets about 3/4 empty, I would clamp it again, add more until it was complete. So now I have administered his full feeding, so I go ahead and pinch that off. And I would next have to flush his tube again with saline to ensure patency of the tube. So once more, just pinching this off, that, and then with a new syringe, and then I would fill 30 milliliters, release, hold, pinch. And then I would go ahead and get this off of him now that we're all done. Are you still comfortable? You are? Okay. I put my side rail up and lower the height of the bed to the lowest position. And I want to make sure I leave the head of the bed elevated between 30 and 45 degrees for at least 1 hour after the feeding. I would just make sure my patient had his call light within reach, and I would come back in 1 hour to assess my patient.